Hi, my name is Anne Cody, and under the restructuring that followed the new strategy that you've just heard about, I am now the head of research, investigator-led grants, research careers and enablers. And I would like to share some thoughts that we've had so far in this space with you. So to start out, I'd like to say that most of the schemes that are aimed at investigators and career development will continue. You will see a lot of familiar formats over the coming years. However, we will, of course, adapt them somewhat to sit very comfortably within our new strategy. In addition, we will have new and targeted opportunities in collaboration with the Department of Health and the HSE and other stakeholders. My colleagues, Maura Heine and Teresa Maguire, will tell you more about those, and these are not covered in my slides now. We will also continue participation in EU funding opportunities. In fact, we do hope to strengthen our engagement in EU initiatives over the coming years. So, where are we now? At the moment, we have 5 calls open, which all happen to be with funding partners. 3 of them are EU calls. One of them is the ongoing partnership with the Wellcome Trust. And the final, last not least, one is about research exchange visits with France, jointly with the IRC under the banner of Ulysses. We also are working on 8 calls where applications have closed and where we are at different points of processing of applications and coming towards a funding decision. Now, this is what you presumably all wanted to see, which are the new calls to open in 2021. We will start out with a new call for the Investigator-led awards in spring, and we hope to get a good response to that. We will also open the next round of the Investigator-led projects, and it looks likely that the timing for those awards will be slightly different from previous rounds, where we would have opened them in August. We are now looking to open them in late June, early July, and keep them open into September, so throughout the summer and a little bit beyond. We are also planning for a new round of the Applied Partnership Awards, where we're aiming to bring together researchers and knowledge users. And the research collaboration for quality and patient safety that we do jointly with the HSE is also going to run again. The conference and event sponsorship scheme had been put on hold last year because of the very limited need to support physical events and conferences. We hope to be able to put it out again in Q3 of this year, but obviously we'll keep the situation under review and look at the public health situation before we come to a final decision there. We are entering the 11th round of the joint funding scheme with the health research charities in Ireland, and we would hope to have documentation and all that finished from our side late in the year, in Q4. And but bear in mind that it's the participating charities that actually open the calls, so you would expect staggered opening times depending on the charity between maybe November and January or so. The secondary data analysis projects were very well received when we opened them first in the previous round, and we do hope to keep doing those, in particular sort of highlighting the importance of secondary data and data in general in the HRB strategy and for health research. And we also hope to have another intake of the HRB postdoctoral interns, to train them in all things research funding, but also to give them opportunities to work in the HRB Evidence Centre and in the HRB held National Health Information Systems, to give them a really broad experience. And certainly our experience with these guys has been fabulous. They're very, very good, and hopefully they get a lot from it. Just a little caveat that obviously all calls before we go out to them need to be approved by the board. So that's as it always has been, but there may be sort of small tweaks to that calendar. We've also been thinking about the pipeline of calls to open in 2022, and we're likely to start off the year with the 2 postdoctoral awards, the Applying Research into Policy and Practice for academic researchers, and the Clinician Scientist Fellows for health professionals. There are always a variety of EU calls that start out early in the year. We don't have the details of this yet, but we expect to participate. And personally, I'm particularly looking forward to a new round of the Knowledge Exchange and Dissemination Scheme. They are really good at adding value to existing awards, and we would hope to open them again when the opportunities for a knowledge exchange have actually increased and become better again. The Definitive Intervention and Feasibility Awards would be on the calendar again for 2022. This is obviously important in the context of health research and also in the context of the significant investment we are making into clinical research infrastructure. And we have not had new Clinician Scientists Awards, the most senior level of career support for health practitioners in a while, and we do hope to go out with that call in 2022. 2 related topics that I'd like to mention. One of them is what we've been doing around public and patient involvement in research, or PPI for short. PPI is emphasised a lot more in our current strategy than it was in the 2016 strategy, and that reflects that we actually know a lot better what we want to do there at this point, and also the leadership role that the HRB has taken up in this space over the last 5 years. Happily, I can say that the PPI Ignite network will start up now in March. This builds on the previous PPI Ignite awards in 5 universities, but it now includes 7 lead sites. It includes 10 national partners and 54 local partners, so it's really grown into a very substantial network. We also plan to go out soon with another survey to inform what else the HRB might do to support PPI. You might remember that we did a survey in 2016, and out of that arose PPI Ignite, our emphasis on budgeting for PPI and a number of other things. And it's time to refresh that. So I would ask you all really to think about what you would find the most useful support that the HRB could provide. And we also want to take stock of the quality of PPI sections in applications. We started including a question in application forms in 2014, and we want to compare that versus some of the most recent crops of applications. And my gut feeling is that a lot has changed in the meantime based on work that not only we have done, but also many, many others in the country and in the system. But I'd like to see evidence of that as well. And that leads neatly into our thoughts about research on research. We have a long history of continuous improvement, but that's typically been based on experience and expertise, and we want to get more systematic about the evidence base for some of our practices. We are currently involved in some projects of that nature, internally or externally led, and we will develop a more formal approach over the next year or so. But if you do have a burning research on research question in the meantime where you would like HIB data or input, let us know, and we'll do what we can in the meantime. And that's where I would leave it for now, and I'd hand you over to my colleagues.